Cosmetic surgeons and aesthetic surgeons generally do the same procedures, however their training is a little bit different. Cosmetic surgeons are generally trained in non-plastic surgery, for example, ear, nose, and throat, family medicine, general surgery. They can perform cosmetic surgery in Canada. Aesthetic surgeons are trained specifically in plastic surgery, so they have more training in aesthetic surgery, and they perform aesthetic surgery or cosmetic surgery here in Canada. Choosing a plastic surgeon, first and foremost, you have to make sure that your plastic surgeon, he or she, has the credentials. They have to be board certified by the Royal College of Physicians or Surgeons in plastic surgery. Number two, and I think that's as important, is you have to feel comfortable with your plastic surgeon. This is a human thing, it's a human interaction, so you have to be comfortable with your plastic surgeon who is qualified to do plastic surgery. The pre-surgical process includes a consultation with the plastic surgeon and his patient or her patient. It includes a thorough history and physical exam and past medical history. The most important thing is for the plastic surgeon to make sure that the procedure will be safe and the patient will be physically able to undergo a plastic surgical procedure. As importantly, the plastic surgeon has to know that they can deliver the procedure and outcomes that the patient wants. So the patient has to have realistic expectations. To maximize safety, I inform my patients of any things that they can do to prevent complications, including stopping smoking, eating well, and walking as soon as possible after the procedure. Number two, I make sure that they're physically and emotionally ready for the procedure. I look at their past medical history and their current state and physical states and make sure that they are ready for the procedure. Also, intraoperatively, I make sure I deliver the appropriate medications and appropriate atmosphere and environment for the procedure to minimize complications. To maximize comfort in the consultation setting, preoperatively, intraoperatively, and postoperatively, I always try to make a rapport with my patient. I want them to feel comfortable with me as a human and as a surgeon. Patients can reduce their recovery time and increase their safety by listening to what their surgeons tell them. Most important thing is to stop smoking pre and post-operatively. Number two, increase their nutrition and foods that are high in protein. Number three is to try to mobilize as soon as possible after the surgery, as long as the surgeon allows them to do that. To find out more information about specific procedures, you can always visit my website at www.drhanisinno.com. You can go to the contact section to book an appointment with me for a consultation.